Hi guys, welcome to another video on Med USMLE. I'm Michele Persico and today I'm going to introduce you to the tips and tricks to approach and solve each question in Tremor you could encounter on test day. So let's get started. So each question on Tremor will be quite straightforward to identify. Generally, the chief complaint for which the patient sees the doctor is plainly reported as tremor in the question stem. Sometimes they will have the term shakiness instead of tremor, although it's not that common. The age is not important to remember, just forget about it. It doesn't help in your differential, it's just a waste of memory to remember for test day. Sometimes you will have a video of a patient with tremor in the question stem, so if you click on it, it will open a video that will show a patient with a certain type of tremor. So make sure to see a YouTube video for each type of tremor so you don't feel lost on your test day. Your job, in fact, for this type of questions is to identify the correct etiology of the tremor, which can be cerebellar, functional, aka psychogenic tremor, Parkinsonian, essential, or physiologic tremor. Let's go into the next slide in which I will show you on how to differentiate between these different types of tremor. So guys, the first step in the differential is to identify the amplitude and the frequency of the tremor reported in the question stem. So the frequency of the tremor is how many movements per second, whereas the amplitude is the extension in the space of the tremor movements. If the tremor is low frequency, it means that it can be cerebellar or functional, aka psychogenic tremor. If the tremor is high frequency, on the other hand, it can be physiologic, Parkinsonian, or essential. The mnemonic that I used on test day to remember the high frequency tremors is HIPPY. H and I stands for high frequency, P stands for Parkinsonian, PHI in green stands for physiologic, and D stands for essential. This way I can also infer the low frequency tremor just remembering this acronym of the high frequency tremors. Anyway, another important piece of information that you have to keep in mind on test days is 5 Hz. This is the cutoff between high and low frequency tremors. More than 5 Hz means high frequency tremors, whereas lower than 5 Hz means lower frequency tremors. Lastly, another important rule to remember is that frequency and amplitude are inversely proportional. This means that if the tremor is low frequency, it is high amplitude, and vice versa, which means that if the tremor is high frequency, it means it is low amplitude. This can help you remember both the characteristics and with just one rule. And so the concept you have to keep in mind for test day are the mnemonic HIPPY, the rule that amplitude and frequency are inversely proportional, and the number 5 Hz. Now, of course, you see that there are 2 subclasses. In each subclass, there are different tremors, so this is not enough to differentiate between one tremor or another. So let's go to the next slide in which I show you how to differentiate more in detail each tremor. So guys, step 2 to differentiate one type of tremor from another is to understand which actions increases or decreases the tremor. In low frequency high amplitude tremor, we said we have the cerebellar tremor and the functional tremor. So if you see in the question stem that they're speaking about action tremor, it is only cerebellar if the frequency is low and the amplitude is high. Whereas it's a distraction tremor, in case if it's a distraction tremor in the question stem, in that case you have to identify it as functional tremor. So action tremor means that the tremor increases when there is a goal-oriented movement. For example, there is finger to nose testing. This is a classical example. And if you see finger to nose testing, which is positive in the question stem, this means that there is an action tremor which identifies as a cerebellar tremor if the frequency is low and the amplitude is high. Whereas if you see in the question stem that, for example, the tremor ceases, so stops, if the physician starts to ask question to the patient is concentrated in answering that question, this means that the tremor is a distraction tremor, and the distraction tremor has only one etiology, which is the functional tremor. So Basically, action tremor and distraction tremors are not tremors per se, but they are characteristics of the tremors. The real tremors are the cerebellar tremor and the functional tremor. These are the two etiologies that you have to keep in mind. Anyway, if there is high frequency tremor and a low amplitude tremor, you have to consider three possible etiologies: Parkinsonian tremor, essential tremor, and physiologic tremor. So if the tremor increases at rest or starts when the patient is not moving, so the tremor is a resting tremor, which identifies as Parkinsonian tremor. Whereas if we have action tremor plus postural tremor, we can have two different etiologies like essential tremor or physiologic tremor. So I talked to you before about the action tremor. What is the postural tremor? The postural tremor is a type of tremor that is increased when the patient outstretches his hands. So if you see in the question stem that the patient, when the patient outstretches his hands and arms, the tremor increases. So in that case, you have to think about an essential tremor, physiologic tremor. Another important kind of aspect that I used to keep in mind is that what increases and decreases the tremor, so the action that changes the tremor characteristics, are more common than the amplitude and the frequency. This means that in the question stem, more often than not, you will see description of action tremor, postural tremor, resting tremor, distraction tremor, but not there is no indication of the amplitude or the frequency. So this slide is really important because it sometimes is the only information that you will have in question stems to answer questions on tremor. Now, you see that in the high frequency low amplitude tremor, if there is a resting tremor, is Parkinsonian, whereas if it's action and postural, you have two possible etiologies, which you have to make a differential diagnosis. Actually, it's really common that question writers will try to test your knowledge about essential or physiologic tremor. So you have to know how to differentiate these two, and I will describe it in the next slide. So let's go to it. So to differentiate between essential and physiologic tremor, you have to keep in mind the characteristics of the tremor. First of all, the essential tremor is symmetric, whereas the physiologic tremor is asymmetric, which means that they will describe in the essential tremor that both the hands are shaking, whereas in the physiologic tremor just one hand is shaking, the left or the right. Whereas in the essential tremor there is head involvement, so it will be sometimes described also as head bobbing. In the physiologic tremor there is no head involvement. Another important feature is alcohol. So in essential tremor, if the patient drinks alcohol, he or she will describe decrease in the tremor after taking the alcohol, whereas in physiologic tremor, if the patient takes alcohol, generally the tremor increases. And another important findings are the findings on history. So if there's family history of tremor, most likely it is essential. So there are sometimes essential tremors which have an autosomal dominant transmission, and so it's common that the tremor is described as present also in the father or the mother and in the grandparents. In case of physiologic tremor, the history is still important because there are some possible causes that increases a physiologic tremor and make it apparent, because sometimes can be subclinical, and this causes kind of increases the tremor and make it visible to the patient and to the physician. This is the hyperthyroidism for the diseases, possible diseases, and as far as medication history goes, SSRIs, lithium are two important causes that increase this type of tremor that you can find on test day. So guys, this is a flowchart on the tremor that hopefully will help you to synthesize everything that I told you about before. So if the tremor is low amplitude and high frequency, it can be functional, it can be cerebellar. So if it's a tremor that increases with movement, it's most likely that it's cerebellar, which is if a tremor that ceases or stops with the patient getting distracted, it's a functional, like a psychogenic tremor. If the tremor is high amplitude or low frequency, it can be a Parkinsonian tremor, essential or physiologic tremor. If the tremor starts at rest, it is 100% Parkinsonian. If the tremor is action tremor plus postural tremor can be essential or physiologic. To differentiate between these two, we have to keep in mind other features of the tremor. So if it's asymmetric, the head is involved. There is decrease of the tremor with the alcohol intake. If there is family history of patients, family history in the patient with relatives that has similar symptoms of the patient, it most likely is an essential tremor. Whereas if the tremor is symmetric, increases with alcohol, or increases with hyperthyroidism and drugs like SSRI or lithium, this means that tremor is physiologic. It's really important to keep in mind this number that I'm circling right now, which is the hertz of the physiologic tremor, because this is a buzzword for physiologic tremor. Only this type of tremor has a really high frequency with hertz that reach a number above 10. And so keep in mind this for test day. This will definitely help you to answer the questions. And as a kind of, I'll try to remember you that also this first part of the flowchart, so the amplitude and the frequency, are not really so important because you won't find this in so many questions. The most important part is the bottom part of this flowchart, in which you will find in most of the questions demo vignette. Anyway, some questions will show the frequency, will show the amplitude, so it can be useful to remember for test day. Alright, so now I'll give you a question, and hopefully this will be helpful to kind of practice on making a differential diagnosis between the different types of tremor. Feel free to stop the video for a couple of seconds and try to answer the question yourself. I'm going to read the question and the question stems and the answer choices, after which I will give you my explanation on how to solve these kind of questions. So here we go. A 51 years old Caucasian male comes to your office complaining of tremor. The shakiness of both of his hands started a few months ago. The tremor worsens each time he attempts to drink a glass of water and improves each evening, right after drinking a glass of wine while having dinner. On inspection, the patient shows a low amplitude tremor bilaterally that worsens when he outstretches his arms. He has a history of asthma, requiring albuterol as needed. His family history is significant for his father and paternal grandfather having similar symptoms. Which of the following is the most appropriate pharmacotherapy? A. Primidone, B. Propranolol, C. Gabapentin, D. Midazolam, E. Levodopa, and F. Cabergoline. So I will pause for a couple of seconds, and then I will start with the explanations. Feel free to stop the video and try to answer the question yourself. So guys, first of all, it's clear that this is a question about the tremor because it's clearly stated in the question stem that the patient comes as complaining for tremor. So now you remember that the most important part in solving questions in the USMLE is to read the last sentence first. So I have highlighted it here for you. And the question basically asks for which drug is used to treat this patient tremor. Of course, to answer this question, you need to know about which tremor we are talking about in this question stem. And so it's important to work with our differential. So with no further ado, let's start to think about how to differentiate each type of tremor. So we have to start with the step 1 of my flowchart, and the step 1 was showing what, guys? Try to answer yourself. So if you answered amplitude and frequency, you are right. This is the step 1 of the differential. You have to find in the question stem if they're talking about amplitude and frequency. So this patient has a low amplitude tremor, which means he has a high frequency tremor because amplitude and frequency are inversely proportional. And if you remember, I told you that you have to use the mnemonic that I told you about before about high frequency tremor, which is HIPPY. So this is useful to remember the type of tremor that you can find on test day. So H and I stands for high frequency, P stands for Parkinsonian, PH and Y stands for physiologic, and E stands for essential tremor. So now you know that the patient has one of these three types of tremors, and you have to proceed with step 2 to kind of analyze and understand which one of these three we are talking about. So let's go to the next slide to understand how to differentiate between these three. So step 2 to differentiate the type of tremors is to identify the movements that changes the tremor, so increases or decreases the tremor. So if the tremor worsens each time the patient attempts to drink a glass of water, this is a characteristical description of an action tremor, whereas the tremor worsens also if he outstretches his arms, and this is another characteristic of the postural tremor. So we have two different types of tremors, action plus postural, and this means that we can identify just two types of tremor from the high frequency low amplitude, which are the essential and the physiologic tremor, and we can rule out the Parkinsonian tremor because the Parkinsonian tremor is a resting tremor. So now we have narrowed down to two options. Now let's go to the next slide to kind of differentiate between essential and physiologic tremor. So you can see in the question stem that I have highlighted for you the different clues that will allow to you differentiate between physiologic and an essential tremor. So it says that the tremor improves each evening right after drinking a glass of wine, and the family history is significant for his father and paternal grandfather having similar symptoms. So we have basically alcohol that improves the tremor, and there is also a history of relatives that have the tremor. This is really straightforward. This is what it is, guys. Try to answer yourself. So if you answer essential tremor, man, you nailed it. Congratulations, you did a great job. And now you have to understand which pharmacotherapy should be used for essential tremor. So you have to consider that the first, second line treatment for essential tremor are propranolol and primidone. Propranolol is the first line and primidone is the second line. It's easy to remember that primidone is the second line because it's a barbiturate. And you know that barbiturates are drugs with important side effects compared to a beta blocker. So that's normal that propranolol is the first line treatment compared to primidone. Anyway, these are two viable answer options, and there is a clue in the question stem that will help you understand which one of the two you have to select. Try to answer yourself. I will give you a couple of seconds and then I will show you the answer. This patient has an important clue in its question vignette, which is that the patient is asthmatic and is taking albuterol. So this patient can't take propranolol because, as you can imagine, propranolol being a non-selective beta blocker causes bronchoconstriction, and that's why propranolol is contraindicated in patients with asthma, which means that primidone, although is a second line treatment, in this situation becomes first line because the patient has asthma, and so primidone is the right answer choice. And so this is the answer to our question on essential tremor. A last piece of information I would like to give you is that questions on tremor are typical of the USMLE Step 2 ZK and Step 3, but they are not so common for the USMLE Step 1. I remember that I answered questions on tremor for the USMLE Step 1, but they were pretty much straightforward to answer, and I didn't need the information that I presented to you in this YouTube video to answer them. So keep in mind that this video will be more helpful for you for the preparation for the USMLE Step 2 ZK and Step 3. Do not stress too much about it if you're preparing for the USMLE Step 1. So guys, this is the end of the video. Thank you so much for watching. I hope you enjoyed it. And if you did, please hit the like button and subscribe for more content. I will try to upload at least one video per week with more content on the USMLE preparation. So see you next time.